It all belongs to you. Said it all belongs to you. Hey, it all belongs to you. It all belongs to you. It all belongs to you. Every air that we breathe, Lord. Everything that we are, Lord. It all belongs to you. It all belongs to you. Hallelujah.
Glory to Jesus. It felt like that shouldn't end, isn't it? That moment of worship was electrifying, was terrific, and we could feel God's presence. Myself and Dr. Chicks. Dr. Chick, how was that?
Oh, it was beautiful. It was
yeah, I could see that in your face. So that is our church experience, a moment of worship. It's our culture on this show to inculcate the spirit and the lifestyle of worship in our children, because that is the best way to lead an effective life in pursuit of success. As children, as students, there is what we call the God factor, and that is why the worship of the true God, the only true God, right, is very, very key. Is that okay, children? I did that for you, and I want to believe you had a very, very nice moment of worship. So it is still Harmon Kid Showtime live at Harmon 94.3 FM, and of course I have my amazing Dr. Family Dentist in the house already, who is ready to take us on an expository journey into the world of oral health care, all right, in a very, very swift and a very, very interesting way. Dr. Cheese, I want to believe I'm correct with what I just said.
Yes,
now.
you're correct.
So just say hi to our listeners.
Okay, hi, good evening everybody, good evening all kiddies. This is the Oral Healthcare Clinic in Amon 94.3 FM. Last week we talked about oral health education, and we gave a plethora of instructions of what we're supposed to do. So hopefully I'm going to recap that before we talk about what we have to do today.
Exactly. Thank you very much, Doctor. Let's quickly take this call, then we get ahead. Hello?
Hello, sir.
Hello, good evening. How are you doing today?
Good evening, ma. I'm fine.
Okay, so you know what you do for me right now. Just turn down the volume on your radio set, turn off the loudspeaker on your phone, and keep a distance from your radio set. Is that okay?
Yes, sir.
Yes, I can. But have you done what I asked you to do? Have you done that? Keep
Yes.
a distance. Good.
There's no any question.
Very good. So what's your name, please? Your name?
My name is Daniela.
Oh, Eniola. Okay, you're calling from Wakajayi,
Yes.
I guess.
Yes. Yes,
Okay,
sir.
okay. How are you doing? You just wanted to say hi to Daniel King, right?
Yes, sir.
Okay.
Well done, sir.
Thank you very much, Eniola, for your consistent moral support on my shows. Thank you very much. I do appreciate it.
Don't forget me, sir.
Not at all, not at all, not at all. All right then. Thank you very much. So, Dr. Chooks, without any further ado, I'd like us to just get into the main business of today as regards oral health clinic series, talk show series, which we started out last week Sunday, and today will be a different approach entirely, and I believe it's going to be a wonderful and worthwhile learning experience to our listeners. So can we just get to it, sir?
Okay, good evening everybody once again. So today we're going to talk about mouth odor. Oral malodor is also known as halitosis, a scientific name, mouth odor. So, but before we talk about the details of mouth odor, I just want to do a quick recap of what we learned last week for the benefit of those who weren't with us last week. So, number one, we talked about oral health education, the basic things that we can do in the family to help us to take care of our oral health. So, number one, we talked about the choice of toothbrush. We said there are different kinds of toothbrush based on the strength of the bristles, the soft, the medium, and the hard. We said that the soft one is for children when they still have their first set of teeth, which is the milk teeth. We could have soft bristle tooth toothbrush. Second set is the medium bristle toothbrush, which is said is the standard kind of toothbrush for us to use. Then the third kind of toothbrush we say is the hard bristle toothbrush. We say that we encourage people not to use that because it has a consequence. Usually it wears away the surface of the teeth and even causes injuries to the gum, what we call gingival recession. It wears the surface of the teeth and it leads to what we call dentin hypersensitivity. So sometimes people tell you, oh, whenever I take something cold, I feel a shocking sensation. They don't know that it was caused by the hard bristle toothbrush.
Thank you,
so
sir.
the choice of brush is medium bristle for adults, and for children is the soft. And secondly, we talked about how often are we supposed to change our toothbrush. We said every 3 months,
Yes,
or
sir.
whenever the toothbrush bristles freeze. So remember, this is the 5th month of the year. If you bought your toothbrush by January, it's time to change it.
Go change and more.
Then number 3, we talked about the type of toothpaste to use. We say that any toothpaste that contains fluoride, so any fluoridated toothpaste is the correct kind of toothpaste. And number 4, we talked about how often are we supposed to brush our teeth. We said something that is unique, which most of us don't practice. We say that it is last thing at night before sleeping and after breakfast in the morning. Last thing at night before sleeping and after breakfast, not before breakfast. So because we don't brush at night before sleeping, so when we wake up, the mouth feels uncomfortable, we'll brush it and we'll go to school or work with the food debris, which is not correct. So the correct way is to brush last thing at night before sleeping and after breakfast in the morning. So the next instruction said, how do we clean in between the teeth? Because the toothbrush and the toothpaste is for cleaning the surfaces of the teeth. But in between the teeth, what we call the interdental spaces, need to be cleaned as well. So what do we use? So usually, traditionally, when food debris enter there, people use a toothpick. Sometimes people use broom or use pin, all kinds of objects. So we said that we're supposed to use a dental floss for interdental cleaning. So we're supposed to floss daily. So we floss first, then we brush our teeth, then we could now rinse our mouth. In fact, we said that in rinsing our mouth after brushing, it should be once. We're not supposed to rinse many times. Why is it that so? Because the toothpaste contains fluoride and we want fluoride to have a contact time with the surfaces of the teeth. And if it does, it makes the teeth to be resistant to decay. So if we rinse it so hard and rinse out everything, then we have lost that value that the toothpaste has to offer. So we could just rinse once. So this is just a little small overview of what we talked about last week. So you could go check up our last episode to get the complete information.
Exactly. Yeah.
Okay, so today now we're going to look at mouth odor, oral mouth odor. So mouth odor is also known as oral mouth odor, or what we call halitosis. So how does that happen? So remember, the mouth has different functions. One of the major functions of the mouth is for eating. We eat every day, we drink water, so it is busy. It's busy part of our bodies. Always things are going in and all of that. Then secondly, and also another aspect of our mouth is we use our mouth for speaking, for communication. So if the mouth is smelling, there's going to be an issue with our confidence, our self-esteem. So we may not be confident enough to talk to people. So as a dentist, some people come to meet me and say, oh please, my mouth is smelling. Someone told me my mouth is smelling, or somebody shifted away while I was talking, so I'm uncomfortable. Please, doctor, what is the answer to this? So that's what we're going to look at today. We're going to look at the different types of mouth odor and how they are handled. So as a general rule, there is no one treatment for all of the mouth odor. There are different types that are handled differently. So that is what we're going to look at briefly.
So that is just an introduction, and we are about to dive into the main business. Is that okay? So before we do that, we just want to take a quick music break so that it will just be talking, you know, without no live. Music is live, of course. So with the permission of doctor in the house, we'll just go on a very quick music break, and when we return, we get ahead. Don't go anywhere. It is still Harmon Kids Show time. Children, do not turn the dial, do not touch the dial, do not go anywhere. We would be right back.
There comes a time together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family. And the truth, you know, love is all we need.
Don't worry, we'll finish the song, but then we don't have to leave, just a side, something that is just a break, all right, or a kind of side attraction for the main attraction or the main deal. Is that okay? So let's cook what we are working on already, and when we're done, we will revisit that. So, Doctor, over to you.
Okay, we are talking about mouth odor today. Mouth odor is a major concern. So people come walking into the clinic and say, "Doctor, please, my mouth is smelling." People are complaining. So what should I do? So for us to be able to understand the treatment and the management of what we call oral malodor or halitosis, we have to understand the different types and how they function and how they are manifested and what are the treatment options. So for number one, so there are three types of oral malodor. First of all is what we call the physiological halitosis. You remember we said mouth odor is called halitosis scientifically. So we have the physiological halitosis. The second one is called the psychogenic halitosis, and the third one is the pathological. So it's all PPPP for purposes of remembrance. Okay, so first of all, let's start with the physiological. Physiological halitosis or oral malodor simply means there are times that the mouth just is the breath in the mouth is not fresh, just for a common or simple reason. So examples of things that could cause physiological halitosis is during the period of fasting. Whenever we are fasting, we've not eaten, so what the body does is that it mops up with the storage of energy, and in trying to do that, to get another source of energy from within, it produces some what we call ketone bodies, that comes out in the mouth as a bad breath. So if we are fasting, we may notice that our breath is not fresh. So it's not like there is a particular problem, it's just because of what we're doing, which is doing period of fasting. So another thing that could cause physiological halitosis, for instance, if you have a nap for a long period of, you just sleep and have your mouth closed, so there is no air going in and coming out. So when you wake up, you're going to notice that the breath, your mouth is not feeling so fresh. So that's physiological halitosis. So how do we take care of physiological halitosis? It's simple. You could just take water and gargle, or you could take a mouthwash, rinse, or you could take some of the gums. There are some gums that are sugar-free gums. Okay. You could just chew that and it will freshen your breath. Okay. So that is for physiological halitosis. I hope you got that. Exactly. So these are the common types of, so these are the first type of mouth odor that people may experience. So there is a second one we call psychogenic. Psychogenic is interesting in the sense that the person thinks he has bad breath, but he does not.
Wow.
So how do we know? So let me give you an instance. For instance, if I'm wearing a black shirt, I think that I'm wearing a, so if for instance now this shirt is black,
yes,
then I asked the first person, I said, what color is my shirt? He says black. I asked another person, what color of the shirt? He said black. Then you ask me, I said the color is white. So what do you think? It therefore means that there is a problem with my judgment. If everybody could see that it's black, but I think that it is white, then there is a challenge. So when people have psychogenic halitosis, we ask them, so did anybody complain that you have bad breath or you have mouth odor? They'll say no. You say, okay, how did you know? They say, maybe the last time I was talking, somebody moved away. I say, somebody could have had something itching on the ear. Maybe it's just a coincidence. Somebody just moved away. He said, oh, maybe my mouth is swelling. That's why he moved away. Sometimes just a reflex. People just move away or just shift while you are talking. They now interpret that perhaps my mouth is smelling. And so during clinical examination, as the doctor, you want to also confirm confirm and check, oh, these claims of this patient, is it correct? So when you are doing examination, you also notice that it's not smelling. So nobody has noticed. You doctor examine, you did not notice, but the person says, I am having bad breath. So you see now, there is an issue with the judgment. Everybody thinks this shirt is black, but someone says it is white. So we say possibly this is psychogenic halitosis. So how do we solve psychogenic halitosis? Interestingly, so number one way, what we do is that we just counsel the person, reassure. It is important to know that it's not every disease that requires taking medications or doing a part. So we reassure and say, but sometimes when you reassure people, they will not be comfortable. So there's something we call placebo treatment. There's a treatment you do for people to just give them, it's like you want to make them happy, just to reassure them or not. So you say, okay, come, let's do some cleaning, they'll buy this mouthwash, but really, you know that they don't really have. But when you do that, it gives them a sense of reassurance. Something has been done for me. And when they come back, they say, oh, what's up? What was done for you? You say, oh, their mouth breath has gone. But really nothing. That was just a placebo treatment. Yes. So that is how we manage psychogenic halitosis. So the last one, which is the most common type of halitosis, is what we call pathological halitosis. So what does that mean? Pathological halitosis means that there is an underlying disease condition that is causing the bad breath. And the first of the list that as a major cause of pathological halitosis is poor oral hygiene. When people are not able to, clean their mouth properly the way they're supposed to. I taught us last week how we're supposed to do that. Exactly. So sometimes people have plaque and calculus accumulate, so it causes bad breath. So how do we take care of that? So the simple way to do that is you have to do scaling and polishing, cleaning of the teeth to remove the plaque, the debris, do interdental cleaning. Sometimes we'll have to prescribe a mouthwash for such an individual. So another cause of pathological halitosis, for instance, somebody met me in church several years ago. He said, doctor, my mouth is smelling, and people meet me and tell me, brother, your mouth is smelling.
Wow.
He said, please, what do I do? So amazing. When I looked into the mouth, his mouth was clean. So what is causing it? So what I did, when I examined a little further, just back behind his last upper third molar, I realized that there was a decayed tooth there. Wow. So what will happen? The food debris will lodge in there. So imagine the food that you ate about 3 weeks ago just lodged in there, and it's not as so it will just be smelling. So for that now, that tooth need to be treated. If you don't treat that tooth, the bad breath will solve. So even if you do a cleaning, do mouthwash, it's not going to solve that. So if you have a carious lesion, a decay, or a hole, that need to be taken care of. So in conclusion, the different kinds of halitosis have the way they were formed, and each of them have to be treated accurately. So when people come to the clinic and say, I have a bad breath, so my job as a dentist or as a doctor is to examine and find out which type they have and then treat it accordingly.
Wow. Thank you so much, doctor. This is amazing, and it is enough. It is enough stuff, enough knowledge to pay for, because I know this is what paying for actually. Anything of value and that adds value to people should have a price tag, and I want to believe this is one of those things that does. So thank you very much, doctor. But then you mentioned 3 types now, and their curative measures. Now I like you to, can you spell like each of these, the types?
Okay,
so that, yes, like spell, because we are dealing with children.
Okay,
although I know some parents are listening now, so but because of our target audience, just
pathological is spelled
where I spelled out, then we can gather those questions as regards anything oral health related or family health related. So I like Dr. Chooks to tell us what topic we'll be treating next week Sunday.
Okay, next week Sunday, which is the concluding part of our oral health series, we'll be talking about the common oral diseases, common ones that.
My name is Daniel King, and I've been conversing with Dr. Chooks, full meaning Dr. Asika Chukuma. He is a resident doctor and a family dentist in the university teaching hospital, right? That is UCH in the city of Ibadan, and he has been and families. Is that okay? So if you like to rewatch this particular episode and that of last week, you can search for that